This is Radio Health Journal. I'm Nancy Benson. This week, how might studying COVID in mink help us predict future pandemics?
This is something we also think about as we're looking for mutations. Are there different strains that might come together in an animal and create a strain that we haven't thought of or prepared for yet?
Why researchers are turning to the environment to understand the pandemic, when Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
If you earn $38,000 a year or more, you're actually in the top 10% globally of income. And we know from research that this is the group that causes about half of household climate pollution.
The role each American plays in slowing global warming. Then
they create these fictional trusts, they create tax loopholes, and in a sense they help them protect and preserve their money and create dynasties of wealth for future generations.
The business of growing wealth for the ultra-rich. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station. And subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
With more than 30 million COVID cases nationwide, you might think of COVID-19 as a distinctly human problem. But just because we're at the top of the food chain doesn't mean that other animals are not susceptible to the virus. Mice, white-tailed deer, monkeys, gorillas, tigers, even household pets have all tested positive for SARS-CoV-2. It's nothing new for humans and animals to share a virus. Remember swine flu and bird flu? The CDC estimates that 75% of emerging infectious diseases are linked to animals. Now, a group of researchers are hoping that by studying COVID-19 in animals and in the environment, they'll be able to both predict and even prevent future pandemics.
We have epidemiologists and environmental microbiologists and wildlife biologists and modelers, and all of these individuals have kind of combined efforts to look to see if we can find SARS-CoV-2 in animals and in water around Ohio to try to understand where could SARS-CoV-2 be? Where could it find a potential reservoir? What might be the risks to either an animal population or to a human population if SARS-CoV-2 were to find itself in an animal population? And what kind of mutations might be happening within animals that we should be aware of to help predict and prevent future pandemics?
That's Dr. Vanessa Hale, Assistant Professor of Veterinary Preventive Medicine at The Ohio State University. Hale and her team have tested more than 400 animals for COVID, aiming to learn more about how the virus jumps species.
This particular virus, SARS-CoV-2, appears to have its origin in an animal, potentially a horseshoe bat, has a very close sequence similarity to the SARS-CoV-2 that we're seeing in humans. So we know that this particular virus can jump species. We see that things like cats and dogs and other species can be infected from humans. Now, this has happened at a very low rate and has happened in high-risk situations. So when someone has COVID and might be in close contact with that animal, so it might be, a cat within a household of family that has COVID. But it is not happening frequently. And with the exception of mink, we have not seen animals infecting humans since the start of the pandemic.
Researchers are still unsure why some animals may be more susceptible to COVID than others, and why some, like cows and chickens, don't seem to get infected at all. That's why studying mink has been key for Hale and her team.
Mink appear to have gotten COVID from symptomatic or asymptomatic workers on the farm. We saw sequence signatures in humans around mink farms that looked like the mink infection. So humans gave it to mink, but then there was evidence that mink then gave it back to humans. And so this is something we also think about as we're looking for mutations. Are there different strains that might come together in an animal and create a strain that we haven't thought of or prepared for yet?
But if the virus can spread from humans to animals back to humans, should we be worried about infecting or getting infected from our pets?
Across the world, there has not been a single documented case of any dog or cat or any animal, with the exception of those mink, giving SARS-CoV-2 or COVID back to a human. And so at this point, there's not evidence that animals are playing a significant role in human infections. But you do need to treat them like you might as another family member. So if you get sick, you would want to isolate away from them and not let them lick on your face. You want to make sure that you're washing your hands really well after you interact with them.
Hale says to understand future pandemics, we also have to understand how the virus mutates, like it does in mink. It is possible that more mutations could spell disaster for humans and animals alike. That's why experts are paying so much attention to COVID variants, the result of mutations. But, as Hale points out, mutations aren't always a bad thing.
It is just as possible that that virus may mutate and become less harmful or less concerning or not affect that animal or not be rendered transmissible to humans. So we're really looking for any type of mutation that we can find to try to understand it, because what we do want to know ahead of time is if we can find concerning mutations, then we want to know about that. But it's not saying that that is always the direction that a mutation will go, but it's something that is on our minds as we're doing this work.
Researchers are also looking beyond animals into the environment for answers. Hale and her team have been testing wastewater for the virus and for possible mutations.
Wastewater has given us a really wonderful depth of knowledge as far as understanding presence of the virus within a population, spikes in the virus that we can often see prior to actual spikes in caseload. So people may be shedding virus prior to becoming symptomatic, and so often we can detect a spike in the wastewater before we can detect it in a population. And we can also use that wastewater to look for variants of the virus that may be present. This can help us make decisions about things like where should we focus targeted testing efforts if, say, a particular area of campus might look like it's having a spike in wastewater. Perhaps we might encourage even more testing in that particular area.
Another place where Hale and her team are doing detective work is in stormwater runoff.
That stormwater work is trying to understand, are we seeing SARS-CoV-2 in this urban runoff? And the answer is yes. So in many urban runoff systems, in about roughly a third to a half of the urban runoff systems that we've tested, we are seeing some very low level of SARS-CoV-2. Now, what it's doing there and why it's there is a little bit harder to interpret, but we suspect that this may be due to some cross-contamination with wastewater, and this could be happening underground, potentially in degraded pipes or something like that. We have noted that it is something that we can see in stormwater as well.
You can find more information on Dr. Vanessa Hale and her eScout project, as well as information on all of our guests at our website, radiohealthjournal.org. Our writer this week is Libby Foster. Our studio producer is Jason Dickey. I'm Nancy Benson. Coming up next week on Radio Health Journal.
It's not just being sick, it's the stress that comes with the prices of these drugs that makes you feel worse.
The desperation of not being able to afford the drugs that keep you alive.
Then brain aneurysm through the eyes of a survivor.
First of all, I called my mom to say goodbye because it was that bad that I thought, I'm going to die. This is the worst thing ever. And she said, go to the hospital. And I thought, that's a $50 copay. I'm not going to the hospital.
All that and more on Radio Health Journal.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.